In this video, I'm going to be talking about how to improve ejection fraction. Now, ejection fraction is it's basically a measurement of the amount of blood that a ventricle pumps out of the heart with each contraction. And it's typically measured from the left ventricle because that's the main blood pumping chamber in the heart. And what's considered normal is anything above 55%. Now, there are many things that can improve this. Now, firstly, why does this happen? It's usually due to damage to the heart itself from a cardiovascular event like a heart attack. And now there are some obvious things that can help with this: cardiovascular exercise, going to cardiac rehab, having a good diet that's getting you all the nutrients that you need for the heart. I have a video on cardiac nutrition. It's kind of a long video because there's a lot of nutrients that are required. Make sure to check that out. And besides all of this, are there any supplements or any herbs that you can take that can improve this? Well, I'm going to be talking about that in this video. I'm going to be going over some clinically proven natural ways to improve both your left and right ventricular ejection fraction. So let's get started. So let's talk about ejection fraction. Firstly, what is ejection fraction? It's a measurement of the amount of blood a ventricle pumps out of your heart with each contraction. That means every heartbeat. And it's usually measured as a percentage. Now, an ejection fraction of 55% or higher is considered to be normal. Lower than 50% is considered to be reduced ejection fraction. So whenever somebody has a heart attack, this is one of the things that is constantly looked at to see if the heart is working correctly. Things that can cause it is cardiomyopathy, heart attacks, heart valve issues, and uncontrolled hypertension. These can all cause reduced ejection fraction. Uncontrolled hypertension can truly damage not just your arteries, but your heart overall, the heart muscle itself and the chambers within it. So it's really important to get your blood pressure under control. Now, as far as diagnostics goes, ejection fraction is usually measured from the left ventricle. That's the main blood pumping chamber in the heart. And it can be measured by any of these tests: echocardiogram, the cardiac cath, sorry for the misspelling here, MRI, CT, or nuclear medicine scan. Now, what are the solutions? Now, you notice here that I've given you solutions for left ventricular as well as right ventricular function. Now, here's the thing. The left ventricular one is considered to be more important. And typically, whenever left ventricular ejection fraction improves, so does right ventricular. So the first thing on this list is coenzyme Q10. Now, what is that? I wrote here CoQ10, but the full name is coenzyme Q10. This is actually a nutrient that plays a key role in the formation of ATP. That stands for adenosine triphosphate. That's the energy currency of the body. And this tends to be quite saturated within the cardiac muscles. Coenzyme Q10, in fact, the most rich source of it in the body is the heart. And if you're trying to get this nutrient from your diet, usually eating organ meats like chicken hearts contains the most of it. And I know most people are probably thinking, no way I'm going to eat that. Well, you can supplement with it as well. There are also some herbs that contain coenzyme Q10, like Mucuna pruriens, but typically going with the coenzyme Q10 supplements themselves are fine, or there's a more potent form called ubiquinol. I'm going to do a separate video on coenzyme Q10 and how to pick the right one. The next thing on this list is Arjuna. Now, Arjuna, you probably thinking, hey, I know somebody with the name Arjuna. I heard about that in a story. Actually, it's the name of a medicinal herb used in Ayurvedic medicine. It's been used extensively in clinical research and found to be highly beneficial for treating many aspects of cardiovascular health, not just bringing down your blood pressure and treating patients who have had heart attacks, but it can actually treat conditions like angina, chronic stable angina. And in clinical trials, it has actually proven to be just as effective as drugs such as isosorbide mononitrate. So Arjuna has many uses. However, just going to the store or going to Amazon and buying whatever supplement you find on there is not the way it's supposed to be used. It's not the most effective way. You may get some benefits from that, sure, but the most effective way is not as a supplement. There are 6 different ways that we use Arjuna. in Ayurvedic medicine. And it depends on the patient and the patient's needs. So it's not something that's just one size fits all. So Arjuna is one of those things that you definitely want to speak to a professional about. If you go and self-medicate, well, you have to take responsibility for whatever comes out of that. Don't blame the medicine. Next in this list is hawthorn, actually Hawthorne Berry. This is a berry that grows all over the US, and it's well, not all over the US. It does grow here where I am, though, and I'm in Florida, by the way. And hawthorn berry is actually quite popular. If you had to ever Google herbs for the heart, this is probably the first one that will come up. And that's because hawthorn has been used in extensive research for treating patients who have just had heart attacks and improving their cardiovascular symptoms and the outcome of those patients in terms of their mortality and their quality of life. It's also useful in all of the risk factors associated with cardiovascular health, such as high blood pressure and high cholesterol and the endothelial function. So hawthorn has a lot of benefits, and it also increases left ventricular function, ejection fraction, sorry. And so, yeah, those are the three that's specifically for the left. And of course, they also work on the right. But you're not going to find much information on the right ventricular because it's not what is most emphasized in cardiology when it comes to assessing cardiovascular health. It's typically the left ventricle that is measured because, as I said, it's the main blood pumping chamber. Now, when it comes to the right ventricular, L-Citrulline and L-Arginine. Now, what are these two? They are actually amino acids. They come from proteins. And the truth is, L-Citrulline actually has been used in clinical trials where they've looked at ventricular function overall and was able to increase both left and right ventricular function. And then L-Arginine, by the way, before I stop with citrulline, there's a lot of benefits to L-Citrulline. It's very popular in sports medicine for improving performance and strength and weight loss and several other things as well. Now, L-Arginine you probably heard of, when you might have heard of it. It's very popular as well in sports medicine for increasing nitric oxide, but it's also very popular for improving erectile dysfunction, which is also a circulatory issue many times. And L-Arginine also reduces your blood pressure, and it has a long list of benefits. I think I'm going to do an entire video just on this one amino acid. And now you can supplement with them if you'd like, but typically if you're taking Arjuna and if you're taking hawthorn, you're going to be just fine. And then coenzyme Q10 actually gets depleted in many people's bodies, especially those who have had heart attacks. So it's really important to either consume that from a food source or supplement it. You're obviously going to get more from a supplement. And so, yeah, that's my take on how to increase left and right ventricular ejection fraction. So I hope this information has helped you. And if you have any questions, please feel free to leave a comment. Or you can get in touch with me directly through my website, drnishal.com. I do online video call consultations. So no matter where you are in the world, you can get in touch with me and I can help you. And I'll see you in the next video.